Hey everyone, welcome back to Modern Sex Therapy Institute's Sexuality Speaker Series. I am here today with a lovely and brilliant and remarkable Dr. Kate Balestrieri. Kate, tell us a little bit about what you do and your practice.
Hi, Holly. Thanks so much for having me here today. I'm a licensed psychologist with a clinical and forensic background, a certified sex therapist, a certified sex addiction therapist, and I'm a PACT trained couples therapist. I'm also the founder of Modern Intimacy, which is a group practice across 5 different states. And I spend a lot of time, like you and like many of the other faculty here, talking with folks about every and anything along that intersection of mental health, sexuality, and relationships. And a big part of my focus professionally has been around helping to identify and address problematic or out of control sexual behavior, help people come to a place of stability and healing, and then blossom into a place of thriving in their sex and sexuality. So I would say, in a nutshell, that's kind of what I do.
Beautiful. Thank you for that. And I'm going to go with a question that I think is going to merge the personal and professional, but how has sex changed your life?
Well, I love this question. It's so big, and I would say I'm still learning the answer to it. But throughout the course of my career, certainly I've had a different relationship with sex. When I first started working in forensic psychology, I primarily did evaluations and treatment for sex offenders who were incarcerated or who were in civil commitment programs. So at that time, I think there was a lot about healthy sex that I didn't know because it's not a part of the treatment program for a lot of the offenders that I worked with. Instead, we worked more on behavior modification. So, there have been times in my life when sex has been something a bit unknown and maybe scary, and sometimes that sex has been unknown and kind of exciting. Certainly, as I've progressed in my own clinical work and research and studies, and as I've just become an older human, I've had more experiences with sex, and I would say that my relationship with sex is ever changing and evolving in the sense that I'm learning new things about how it shapes my identity, how it shapes my relationship with creativity, with power, with play. So it's just sort of for me this endless landscape of curiosity, and that's one of the reasons I chose to specialize in this area because when we start to look at sex more dimensionally, we start to understand the holistic effect and place that it has in our lives. And so for me, that's part of the never ending curiosity and fun that comes with this work and comes with sex.
Yes. Oh gosh, I love Maurice Merleau-Ponty, right? Sex and self aren't dualistic. It's not something that we do, but part of who we are. And I feel like you just said that beautifully. Yeah.
Oh, thank you.
Yeah.
Yeah,
It's
it's so
really, yeah.
true.
Yeah. Kate, do you practice from a certain approach or philosophy?
Yeah, I would say my training was primarily from a psychodynamic lens, but and systemic lens. And as my career has progressed, I've gotten more and more entrenched in affect regulation theory, the interpersonal neurobiology, developmental neurobiology, and have really started to make more sense on the integration between body and mind. So a lot of the work that I do is rooted in somatic practices, some psychodrama, some feminist theory, social justice theories and lenses, and then blends together what we know from a psychodynamic or attachment focused lens.
Great. Can you give us an example of what that might look like or how you integrate that approach?
Of course. So when I'm working with a client, one of the things that I'm tracking at all times is what's happening in their nervous system. How are they regulating distress? And so from that perspective, I'm looking neurobiologically, but also from an affect regulation perspective and helping them to build resources so that they can regulate their feelings in a more effective way if they are not effective in the ways that they want. And then I'm also looking at what are some of the triggers from early childhood or from unresolved attachment wounds that might cause for dysregulation? And I'm helping them recognize those things sooner. But I'm also looking at systemically and societally what influences may someone have been exposed to that might create oppression or that might create a dearth of resources or that they might not be able to change in their world. And so, really helping them find ways to cultivate empowerment and to find choice where there are choices or acceptance where there are not, and to grieve where there needs to be grief in that process. So I'm really always looking at the individual intrapsychically, interpersonally, and systemically to create a very holistic conceptualization of what they might be experiencing and how they might benefit from learning different things to improve their life in the way that they want.
Wonderful. Oh, you said so much there.
I told you I can talk.
Yes, yes.
All
You said you used the word grief or grieving. Is there an area of your work that you find particularly challenging?
Um, I think sometimes for me, the thing that can be challenging is when someone's sort of stuck in a place of learned helplessness. They might want things to be different, but they don't yet see a path forward that is self-initiated. So they're stuck in this space where they're expecting other people to change or to do the work for them. And sometimes that can come with a lot of, I'll call it like, well, self-protection, but it can feel very, it can just feel really helpless to be in the room with someone who feels so helpless, especially when on the other side of the looking glass you can see lots of opportunities for action. But I would say that's a challenging space for me.
I'm just curious. I'm going to dig a little bit more on that one. Do you do a good job? Have you learned over the years of being a therapist to not get in that empathy hole, right? To stay out of it, to offer the hand but not get down there with them?
Oh, for sure. I mean, I think that's the hard work as therapists, is to make sure that we maintain differentiation so that we can provide empathy, but also reflection where it's necessary and helpful so that people have that balance of being supported but not colluded with.
Yeah, yeah. What about the most joyous part of your work these days?
Oh gosh, I think one of the things that is so fun and rewarding for me is when one of two things. When somebody has been stuck in an abusive relationship dynamic for a while and they get some traction out of it and they find their inner voice, they find their inner empowerment, and they lean into it and realize they can do something different. That light bulb moment for me is everything. I love watching that so much. And I feel really similar amounts of joy when somebody's been struggling sexually to have an orgasm or to achieve an erection or to have orgasm control, for example, and they're able to do it. And they, again, see that win. And it feels like they kind of, they integrate into themselves in a way that feels so powerful and, like they just have found a home inside.
Lastly, thank you for that answer. That was beautiful. Lastly, a favorite sex or relationship tip.
Oh, gosh, there are so many. Well, one, I would say never fake an orgasm because we don't want to reward unskilled situations unless you feel like it's not safe for you to be honest. That's a different scenario. But I would say just remember that sex is not a performance. It's a co-created experience of pleasure when you're with a partner. And when you can step out of that performative role and really give yourself the space to experience pleasure and to tend to it and to let it live and breathe and amplify, that kind of pleasure is like nothing else. And so I would hope that folks would give themselves the permission to do that and really have an embodied erotic experience.
Kate, thank you so much. This has been wonderful, as I knew it would be. Our students are going to love this. Can you tell people where to find out more about you?
Oh yeah, of course. And thank you again for asking me to do this. It's super fun. For folks who want to reach out to me, you can reach me at modernintimacy.com. I also have two podcasts. One is called the Modern Intimacy Podcast, which is all about sex, mental health, relationships, and social issues. And the other podcast is called Without Consent. And that is a podcast that's deconstructing sexual violence with another psychologist. So feel free to have a listen to those two. You can find me on social media on Instagram and TikTok at Dr. Kate Balestrieri, or on Instagram at The Modern Intimacy and TikTok at Modern Intimacy.
Wonderful. And to you all, thank you again for joining us. Stay tuned next week for another Sexuality Speakers series.